Anemia is a condition where your body doesn't have enough healthy red blood cells to carry adequate oxygen to your tissues. For seniors, this can be particularly concerning because it often goes unnoticed until symptoms become severe. Iron deficiency. Anemia, the most common type in older adults, occurs when your body lacks sufficient iron to produce hemoglobin, the protein in red blood cells responsible for oxygen transport. You might wonder why seniors are more prone to iron deficiency. As you age, several factors come into play. First, your digestive system may not absorb iron as efficiently as it once did. Conditions like atrophic gastritis, a thinning of the stomach lining, or long-term use of medications like antacids can interfere with iron absorption. Second, dietary habits often change with age. Maybe you're eating less red meat, a major iron source, due to dental issues, decreased appetite, or dietary restrictions. Third, chronic blood loss, even in small amounts over time, can deplete iron stores. This might happen due to ulcers, hemorrhoids, or regular aspirin use, which can irritate the stomach lining. Women who've gone through menopause may think they're no longer at risk for iron deficiency, but postmenopausal bleeding or gastrointestinal issues can still lead to anemia. Meanwhile, men are not exempt either. Chronic diseases like kidney disease, heart failure, or even certain cancers can contribute to low iron levels. The key takeaway? Anemia isn't just normal aging. It's a medical condition that needs attention because untreated iron deficiency can lead to fatigue, weakened immunity, and even heart complications. The good news? Once identified, it's often manageable with dietary adjustments and, when necessary, supplements. In the next section, we'll dive into the symptoms you should watch for, because catching anemia early makes all the difference. Fatigue is often the first sign that something's off, but when you're older, it's easy to dismiss it as just another part of aging. However, if you're feeling unusually tired, even after a full night's sleep, it might be more than just slowing down. Iron deficiency anemia creeps in quietly, and its symptoms can be subtle at first, gradually worsening over time. Beyond exhaustion, you might notice shortness of breath after minor activities, like climbing stairs or walking short distances. Your heart may race unexpectedly, even when you're at rest, a condition called palpitations. Some seniors report dizziness or lightheadedness, especially when standing up quickly. You might also look paler than usual, particularly in your face, gums, or the inner lining of your lower eyelids. Another telltale sign: brittle nails or unusual cravings for non-food items like ice, clay, or starch, a condition known as pica. But why are these symptoms riskier for seniors? Because anemia doesn't just sap your energy, it strains your heart. When your blood lacks enough oxygen-carrying hemoglobin, your heart has to pump harder to compensate. Over time, this can lead to an enlarged heart or even heart failure, especially if you already have cardiovascular issues. Anemia also weakens your immune system, making you more susceptible to infections. And if you've noticed more frequent falls or confusion, low iron levels could be contributing, as anemia has been linked to cognitive decline in older adults. Certain seniors are at higher risk. If you have chronic kidney disease, your kidneys may not produce enough erythropoietin, a hormone that signals your bone marrow to make red blood cells. Gastrointestinal conditions like Crohn's disease, celiac disease, or even long-term use of NSAIDs, like ibuprofen, can lead to slow, unnoticed blood loss. Even a diet low in iron-rich foods, common in seniors who struggle with cooking or appetite, can tip the scales toward deficiency. The bottom line? These symptoms shouldn't be ignored as just old age. If you're experiencing even a few of them, it's worth discussing with your doctor. Early detection can prevent complications and help you regain your vitality. Next, we'll explore how anemia is diagnosed, because knowing the right tests can save you from unnecessary guesswork. You've noticed some concerning symptoms, maybe fatigue that won't go away or shortness of breath doing simple tasks. Now what? The first step is confirming whether anemia is truly the culprit, and if so, whether iron deficiency is the cause. This isn't something you can self-diagnose. Proper testing is essential because anemia can stem from multiple underlying issues, and treatment depends on getting it right. The most common initial test is a complete blood count, CBC, which measures your red blood cells, hemoglobin, and hematocrit levels. If these numbers are low, it suggests anemia, but it doesn't explain why. That's where additional tests come in. Your doctor may order serum ferritin test. This measures your stored iron. Low ferritin means your body's reserves are depleted. Confirming iron deficiency, serum iron, and TIBC, total iron binding capacity. These show how much iron is circulating and how well your body transports it. Peripheral blood smear, a microscopic check of your blood cells for abnormalities in size or shape. Vitamin B12 and folate levels. Since deficiencies in these can also cause anemia, ruling them out ensures proper treatment. If iron deficiency is confirmed but the cause isn't obvious, like heavy menstrual bleeding in younger women, further investigation may be needed. For seniors, gastrointestinal GI testing is often recommended because slow, chronic blood loss from ulcers, polyps, or even colon cancer could be the hidden source. An endoscopy or colonoscopy might be advised to check for bleeding in the stomach or intestines. One critical point: don't start iron supplements before testing. Taking iron beforehand can mask deficiencies in blood work, delaying proper diagnosis. Always get tested first, especially since some symptoms overlap with other serious conditions, like heart disease or thyroid disorders. Once diagnosed, the next step is addressing the deficiency through diet, supplements, or both. But how do you choose the right iron supplement? That's where we're headed next, because not all iron pills are created equal. Before reaching for supplements, let's talk about food, your first line of defense against iron deficiency. The right diet can significantly boost your iron levels naturally, but there's a catch. Not all iron is absorbed equally. Understanding which foods pack the biggest punch and how to maximize their benefits makes all the difference in managing anemia. Hemi versus non-hemi iron. Why it matters: iron from food comes in two forms. Hemi iron, found in animal products, is absorbed 2 to 3 times more efficiently by your body. Non-heme iron, from plant sources, has lower absorption but remains important, especially if you eat little or no meat. Top hemi iron sources, best absorption: red meat, beef, lamb, and liver. 3 Oz of cooked beef, liver delivers 5 micron iron. Poultry, dark turkey meat, 2 micron per 3 Oz, and chicken thighs. Seafood, oysters, 8 micron per 3 Oz. Clams, sardines, and tuna plant-based iron champions, non-hemi. Legumes, lentils, 3 mg per 1-2 cup. White beans, and chickpeas, tofu, and tempeh, 3 to 4 mg per 1 or 2 cup. Fortified cereals and grains, check labels. Some provide 100% DV per serving nuts. And seeds, pumpkin seeds, 2 mg per Oz. Cashews, dark leafy greens. Spinach, cooked boosts absorption. Swiss, charred absorption boosters and blockers. Even the richest iron sources won't help much if your body can't absorb them properly. Here's how to tip the scales in your favor. Do pair iron with vitamin C. A glass of orange juice with oatmeal or bell peppers in a spinach salad can triple non-heme iron absorption. Cook in cast iron, especially acidic foods like tomato sauce, which leaches iron from the pan. Space out calcium iron. Calcium, in dairy supplements, competes with iron. Take calcium supplements at a different meal. Avoid tea, coffee. With meals, tannins bind iron. Wait 1 to 2 hours after eating. High-fiber meals with supplements. Fiber can interfere with iron pills. Take them separately. Practical tips for seniors: soft foods for dental issues. Try blended lentil soup, hummus, or iron-fortified cream of wheat. Low appetite? Add liver pâté to crackers or blend spinach into smoothies with strawberries. Vitamin C? Vegetarian? Focus on combining legumes plus vitamin C at every meal. While diet is powerful, some seniors still need supplements due to absorption issues or higher needs, which we'll explore next. But mastering these nutritional strategies ensures you're building a strong foundation first. Now that we've covered iron-rich foods, let's talk about supplements, because sometimes diet alone isn't enough to correct a deficiency, especially for seniors with absorption challenges or chronic blood loss. But walking down the pharmacy aisle can feel overwhelming with so many options. How do you choose? Let's break down the key types of iron supplements and how they differ. Ferrous versus ferric iron. What's the difference? Iron supplements come in two main chemical forms: ferrous iron, better absorbed; ferrous sulfate, most common, highest elemental iron per dose; ferrous gluconate, gentler on stomach, less elemental iron; ferrous fumarate, good balance of absorption and tolerability; ferric iron, less absorbed, rarely used; ferric citrate, ferric sulfate, typically for dialysis patients. For most seniors with deficiency, ferrous forms are preferred because they're better absorbed in the gut. Elemental iron, the key. Metric what matters most isn't the total pill weight, it's the elemental iron, the actual amount your body can use. For example, a 325 mg ferrous sulfate pill contains 65 mg elemental iron. 324 mg ferrous gluconate pill has 36 mg elemental iron. Your doctor will prescribe a dose based on elemental iron, usually 50-100 mg daily for deficiency, lower for maintenance. Liquid versus pill versus capsule pills, char tablets, most common, but some seniors struggle to swallow them. Liquid iron, easier to adjust doses, good for swallowing issues, but can stain teeth, use a straw. Capsules, often gentler than tablets. Some contain powdered iron, specialty and slow-release formulas, heme iron polypeptide, e.g. profurin, derived from animal hemoglobin, better absorbed with fewer side effects, but more expensive. Polysaccharide iron complex, e.g. Novaferrum Ferramax. Non-ionic iron, less GI upset but lower elemental iron per dose, slow enteric-coated, claim to reduce nausea but may pass through the gut before fully absorbing. Prescription versus OTC. Most iron supplements are over-the-counter, but exceptions include IV iron for severe deficiency, malabsorption, given in clinics for rapid replenishment, e.g. Venofer, Injectafer. Combination formulas. Some multivitamins for seniors include iron, but often at low doses, 18 mg or less. Which one should you choose? For rapid deficiency correction, ferrous sulfate, high dose but more side effects. For sensitive stomachs, ferrous gluconate or polysaccharide complex. If pills are hard to swallow, liquid or heme iron polypeptide. Pro tip: always check labels. For elemental iron per dose, not just total compound weight. In the next section, we'll dive into how to pick the best supplement for your specific needs, because tolerability, interactions, and dosing timing all play critical roles in success. Now that you understand the different types of iron supplements, how do you select the best one for your needs? The right choice depends on several factors: your tolerance, existing health conditions, and even what time of day you take it. Let's walk through the key considerations to help you and your doctor make an informed decision. Assessing your iron needs, your supplement regimen should be tailored to severity of deficiency, mild versus severe anemia. Ability to absorb iron, affected by gut health, medications. Tolerance for side effects, GI issues are common. A typical starting dose for iron deficiency is 50-100 mg of elemental iron daily, but your doctor may adjust this based on blood work. Matching supplement to tolerance. If you have a sensitive stomach, start low, try ferrous gluconate, less elemental iron but gentler, or polysaccharide iron complex. Avoid high-dose ferrous sulfate. It's effective but more likely to cause nausea. Consider heme iron supplements, derived from animal sources. These often cause fewer GI issues. If swallowing pills is difficult, liquid iron, easier to take but measure carefully to avoid staining teeth. Chewable or gummy options. Some brands, like Novaferrum, offer these, but check sugar content if diabetic. Timing and formulation. Tricks take on an empty stomach. Iron absorbs best when taken 1 hour before or 2 hours after meals. If stomach upset occurs, take it with a small amount of food, but avoid calcium-rich foods, dairy, or high-fiber meals that block absorption. Avoid antacids, coffee, or tea within 2 hours of your dose. They inhibit iron uptake. Special cases, chronic conditions, kidney disease. You may need IV iron if oral supplements aren't enough. Ulcerative colitis, Crohn's, liquid or heme iron may be better tolerated than pills. Heartburn, acid reflux. Avoid ferrous sulfate, which can irritate the esophagus. Cost and accessibility. Generic ferrous sulfate is the cheapest but may cause more side effects. Polysaccharide or heme iron tends to be pricier but may improve compliance if you tolerate it better. Check insurance coverage. Some prescription iron, like Ferromax, may be partly covered. When to retest iron levels after 2 to 3 months. If no improvement, you may need a different form or IV iron. Watch for overcorrection. Excess iron can be harmful, especially if you have hemochromatosis, a genetic iron overload disorder. Bottom line, the best supplement is the one that corrects your deficiency without causing intolerable side effects. Work with your doctor to find the right balance. Next, we'll tackle how to minimize side effects, because even the best supplement won't help if you can't stick with it due to nausea or constipation. Iron supplements are notoriously tough on the digestive system, but that doesn't mean you have to suffer through nausea, constipation, or stomach cramps to correct your deficiency. With the right strategies, you can minimize discomfort while still getting the iron your body needs. Let's explore practical ways to make supplementation more tolerable. Common side effects and why. They happen when you take iron supplements, especially in higher doses. Your digestive tract reacts. Here's what you might experience. Nausea, vomiting. Iron irritates the stomach lining, triggering queasiness. Constipation. Iron slows gut motility, making stools harder and more difficult to pass. Dark stools. Harmless but alarming if unexpected. Iron turns stool black or greenish. Diarrhea, less common. Some people react paradoxically with loose stools. Metallic. Taste. A lingering iron flavor in the mouth after taking liquid or chewable forms. Proactive ways to reduce GI upset. Adjusting your supplement routine. Start low, go slow. Begin with half your prescribed dose for a few days, then gradually increase. Switch forms. If ferrous sulfate causes issues, try gentler options like ferrous gluconate or heme. Iron polypeptide. Take at bedtime. Sleeping through the initial nausea window helps some people tolerate higher doses. Use enteric-coated or delayed-release pills. These dissolve later in the intestines, bypassing stomach irritation, but absorption may be slightly lower. Dietary and lifestyle tweaks. Pair with food, strategically. A small snack like toast or applesauce buffers stomach acid without blocking too much absorption. Hydrate aggressively. Drinking plenty of water combats constipation. Warm. Liquids, herbal tea, broth can stimulate bowel movements. Add fiber gradually. Psyllium husk or ground flaxseed helps, but don't take it within 2 hours of your iron pill. Fiber can bind iron. Move regularly. Even light walking stimulates digestion and prevents constipation. Over-the-counter relief stool softeners, like docusate sodium, help if constipation becomes problematic. Ginger or peppermint tea, Soothes nausea naturally. Probiotics. Emerging research suggests they may improve iron absorption. And gut tolerance. When to call your doctor. While some discomfort is normal, certain red flags warrant medical attention. Severe abdominal pain could indicate gut irritation or supplement lodging in the esophagus. Blood in stool. Dark stools are normal. Bright red blood is not. Unrelenting vomiting, diarrhea, leading to dehydration. No improvement in anemia symptoms after 4 to 6 weeks of supplementation. The trade-off, tolerability versus effectiveness. If side effects make you skip doses, the supplement isn't working, even if it's theoretically the best form. Consistency matters more than perfection. Work with your doctor to find a balance between adequate iron intake and manageable side effects. In the next section, we'll cover dangerous interactions because some medications and health conditions don't mix safely with iron supplements. While iron supplements can be life-changing for seniors with anemia, they don't play nice with certain medications and health conditions. Taking iron carelessly could reduce the effectiveness of your prescriptions or even create new health problems. Let's examine these critical interactions so you can supplement safely. Medication interactions. You must know antibiotics, tetracyclines, doxycycline, and fluoroquinolones, ciprofloxacin. Iron binds to these antibiotics in your gut, reducing their absorption by 32 to 40%. Solution. Take iron at least 2 hours before or 4 hours after these antibiotics. B. Thyroid medications, levothyroxine, Synthroid. Iron dramatically decreases its absorption, potentially worsening hypothyroidism. Solution. Take thyroid meds first thing in morning and wait 4 hours before iron. C. Osteoporosis, drugs, bisphosphonates, alendronate. Iron interferes with absorption of these bone-strengthening medications. Solution. Take separately with at least a 2-hour gap. D. Heartburn medications, PPIs, omeprazole, and H2 blockers, famotidine. Reduced stomach acid impairs iron absorption by 50–70%. Solution. If possible, take iron in morning before PPIs or discuss alternatives with your doctor. Health conditions that require caution. Hemochromatosis. This genetic iron overload disorder makes iron supplementation dangerous. Action. Always test for this condition before starting iron therapy. B. Chronic kidney disease may require special formulations or IV iron due to altered metabolism. Action. Nephrologists often prescribe specific iron protocols. C. Ulcerative colitis, Crohn's disease. Iron can exacerbate inflammation in some patients. Action. Consider low-dose liquid iron or IV supplementation. Nutrient competition, calcium and magnesium. These minerals compete with iron for absorption. Solution. Separate intake by 2 to 4 hours from iron supplements. Zinc and copper high-dose iron can deplete these essential minerals. Solution. Consider a balanced multivitamin if taking iron long-term. When iron supplements are dangerous, after recent GI surgery, risk of strictures where pills could get stuck, with active GI bleeding, may mask serious conditions. During infections, some bacteria thrive on iron. Practical safety tips. Always disclose all supplements to your doctors and pharmacists. Keep iron safely stored. Child-resistant packaging is crucial. Iron overdose is a leading cause of pediatric poisoning deaths. Never crush or chew. Enteric-coated tablets unless directed. Critical reminder. If your doctor prescribed iron, don't stop taking it because of these warnings. Instead, work with them to optimize your regimen. Proper timing and formulation adjustments can usually resolve these issues. In our next section, we'll discuss how to track your progress, because correcting anemia isn't just about taking supplements, but ensuring they're actually working. You've been taking iron supplements diligently, but how do you know they're actually working? Unlike some medications that provide quick symptom relief, iron supplementation requires patience and proper monitoring. Let's explore how to track your progress effectively and when to expect improvements. 1. The iron replenishment. Timeline, understanding. This process helps set realistic expectations. Week 1-2, initial blood cell changes begin. You likely won't feel different yet. Possible side effects peak during this period. Week 3-4, reticulocytes, young. Red blood cells. Increase energy levels may start improving. Some report better sleep quality. Month 2-3, hemoglobin levels should show measurable improvement. Noticeable reduction in fatigue and shortness of breath. Skin color often appears less pale. Month 4-6, iron stores, ferritin, begin replenishing. Full therapeutic effect, typically achieved. Maintenance phase may begin. Key monitoring tests. Your doctor will likely recommend complete blood count, CBC, checks hemoglobin and hematocrit levels. First follow-up typically at 4 weeks, subsequent tests every 2 to 3 months until stable ferritin level. Measures iron stores. Important. For determining when to switch to maintenance dosing. Reticulocyte count shows bone marrow response, early indicator of treatment effectiveness. Tracking symptoms at home. Keep a simple log to monitor. Energy levels, rate 1 to 10 daily. Exercise tolerance, cognitive clarity, nail and hair changes. Any side effects? Helpful tools. Basic fitness tracker, monitors heart rate trends. Sleep. Quality apps, simple before and after photos. Pale conjunctiva improvement. When to worry about lack of progress? Contact your doctor if no symptom improvement after 6 weeks. Hemoglobin fails to rise after 3 months. Side effects prevent consistent dosing. New symptoms develop: chest pain, severe weakness. Transitioning to maintenance. Once levels normalize, reduce dosage, often by 50%. Switch to alternate day dosing. Focus on dietary iron sources. Continue periodic monitoring every 6 to 12 months. Important. Don't stop abruptly. Iron stores take time to build and can deplete quickly if supplementation ends too soon. In our final section, we'll discuss long-term management strategies to help you maintain healthy iron levels and prevent recurrence of anemia. Reaching normal iron levels is a significant achievement, but the work doesn't stop there. Without a smart maintenance plan, many seniors slip back into deficiency within months. Let's build a sustainable strategy to keep your iron levels stable and prevent anemia from recurring. Maintenance supplementation. Less is more. After correcting deficiency, most people need ongoing support. Reduced dosage. Typically 30 to 60 milligrams elemental iron every other day. Studies show this maintains levels better than daily low dose. Cyclic approach. 1-2 months on, 1 month off, with doctor monitoring. Hemi-iron alternatives. Gentler for long-term use with fewer side effects. Pro. Tip. Take maintenance doses with vitamin C-rich foods like citrus or bell peppers to enhance absorption without increasing iron. Quantity. 2. Dietary habits for lifetime prevention. Transform your eating patterns with these sustainable tweaks. Weekly iron-boosting habits. Meatless Mondays. Make them iron-rich. Lentil stew with tomatoes, spinach omelets, cast iron cooking, especially for acidic foods, tomato sauce, applesauce. Strategic food pairing, vitamin C at every iron-rich meal. Avoid tea, coffee with food senior-friendly. Adjustments. For chewing difficulties, blend meats into pâtés, add blackstrap molasses to oatmeal for low appetite. Iron-fortified meal replacement shakes. Check labels for 15 to 20% DV iron. 3. Ongoing monitoring schedule, even when feeling well. Blood tests every 6 months. CBC and ferritin annual GI check, especially if previous deficiency had no obvious cause. Medication reviews. Update your doctor about new prescriptions that might affect iron. 4. Special considerations for chronic conditions for heart failure. Patients. Anemia worsens prognosis. Maintain stricter iron monitoring. IV iron may be preferred if oral isn't sufficient after bariatric surgery. Lifelong supplementation, typically needed chewable or liquid forms, often necessary with rheumatoid arthritis. Chronic inflammation blocks iron utilization, may require different treatment approaches. Recognizing early warning signs, stay alert for subtle hints of slipping back. Recurring fatigue that naps don't fix, restless legs at night. Worsening, unexplained hair thinning, cold intolerance returning. When to seek help: contact your healthcare provider if symptoms return despite maintenance. You can't tolerate any form of iron. New GI symptoms develop: blood in stool, black tarry stools. Remember, iron management is a marathon, not a sprint. By making these strategies part of your routine, you're not just treating anemia, you're protecting your energy, cognition, and overall vitality for years to come. Thank you for taking this important journey to understand iron deficiency in seniors. Whether you're managing your own health or supporting a loved one, remember that anemia isn't an inevitable part of aging. It's a treatable condition. Your next steps: schedule that blood test. If you've been putting it off, share this knowledge. Many seniors dismiss symptoms as just getting old. Subscribe for more insights. Hit the notification bell for our Senior Health series. We'd love to hear. What was your biggest aha moment from this guide? Comment below with your experiences or questions. And if you found this helpful, please share it with someone who might benefit. You could be the reason they regain their energy and vitality. Here's to your health and strength at every age.